Next presentation which is by Gagan Neupane. He is going to present on preliminary findings from non-communicable disease in Nepal, NCD Nepal study. Thank you.
Good afternoon, namaste. My name is Dr. Gagan Neupane. I'm one of the volunteer physicians at Affiliations in Nepal, and I'm an incoming PGY1 internal medicine resident at Florida Atlantic University. On behalf of NCD Nepal team, today I'll be talking about our preliminary findings on non-communicable disease in Nepal study, the NCD Nepal study. Here's a list of our authors and affiliations. We declare we don't have any conflicts of interest. Our funding comes from unrestricted support from a non-profit health foundation in Nepal. A little bit of background on non-communicable diseases. We all know these are the leading causes of death globally, with more than 2/3 of death per year. Of them, cardiovascular disease is the #1 cause of death from NCDs, followed by cancer, respiratory disease, and diabetes. It's a chart from IHME 2017, which compares 2007 with 2017 top causes of death in Nepal. Ischemic heart disease remains to be the #1 cause of death in both in 2007 and 2017. However, if you go down the list, we can see a shift in the burden of national burden paradigm from infectious towards non-communicable diseases. In the context of Nepal, there are very limited studies on non-communicable disease, and those which are present in Nepal are only mostly cross-sectional in design with limited sample size, and they do not incorporate laboratory investigations. It is expected that out of total years of life lost due to premature deaths, 49% are due to non-communicable diseases in Nepal. So in view of this, there is an increasing call for implementation epidemiological study of non-communicable diseases in Nepal, and also a national policy is required to identify and treat people with NCD at earlier stages. So far, this is what we are doing. This is a community-based and longitudinal prospective study to understand the epidemiology of non-communicable diseases and to test the effectiveness of community-based implementation approaches in rural Nepal. Yeah, this slide shows the same thing. The objectives are also to foster research and education and to aid clinical practice of non-communicable disease management. The study site is Dang District, Province 5, Gorai Sub-Metropolitan City, Ward number 3, 4, 6, and 7. Here we often get questions regarding the sample size selection, and here I'd like to clarify that we'd like to enroll all the people, eligible participants from Ward number 3, 4, 6, and 7. And in the future, we'd like to expand to the adjoining wards. Any residents aged 40 to 75 years old are eligible to participate in the study. And based on the census of 2018, there is an estimate of total of 7,000 eligible participants. So our study on methods of NCD Nepal study has been published in April 2020, and it's available in PubMed. It basically shows what we have been doing and how we have been doing all this. I'll not go into the study setting details, but this is a summary of what we have been doing. We perform validated questionnaire interview and physical exams, and then based on comprehensive risk factor assessment, we send laboratory investigations in high-risk participants. From the initial visit, there are 3 pathways for follow-up. If the patient is at risk, we follow up in 1 year. If the participant is at risk, we follow him or her up in 1 year's time. And then if without any non-communicable disease, we follow them in 2 years' time. And if with non-communicable disease, we follow them frequently based on our protocol. These are the list of study variables. Altogether, there are 320 variables from the initial visit and 122 variables from the follow-up visit. This is the broader working protocol that we have been following. I'll not be going into the details, but this is what we have been doing. We have seriously dedicated protocols and to manage non-communicable disease like hypertension, diabetes, hyperlipidemia, tobacco cessation. So let me talk a bit about study challenges and future directions. Though we receive unrestricted support from Health Foundation Nepal in terms of financial support. We do have challenges in sustainability of financial support and staff recruitment. In future, we expect support from the government and other stakeholders, including Nepal Health Research Councils and other researchers. So till December 2019, we enrolled a total of 1,232 participants, and this is just a preliminary report of what we enrolled. We are still enrolling the participants. Based on the demographic findings, the average age was 54 years. There were 63% females. The average monthly income was less than $100, and most of the people studied up to primary or secondary levels. The average body mass index was 24 kg per meter square. The average waist circumference was 82 centimeters. 14.2% of the people were current active smokers, and 14.5% were unhealthy alcohol users. The average daily salt intake was 13.4 grams per day, which is much higher than what is recommended by American Heart Association. And the average daily fruit and vegetable intakes were respectively 1.1 and 1.6 servings per day. This table shows the level of physical activities. There's a bunch of data here, but what I would like to highlight is about 17% of the people, participants, were involved in the vigorous activities, which means more than 6 metabolic equivalents, and more than 16% of the people were involved in work-related vigorous activities. In selected high-risk group of individuals, we performed laboratory investigation, including lipid profile. These are the average of lipid profile, total cholesterol. And here I would like to highlight 213 mg per deciliter was the average triglyceride level, which is much higher than the normal range. Similarly, the random glucose level average was 126 milligrams per deciliter. The average fasting glucose was 123, and hemoglobin A1C average was 7% in selected group of individuals. These are all average values of laboratory data. So now the prevalence of diabetes was 7.5%. However, 16.3% of the people were not aware that they have diabetes. Likewise, 27.3% were had diabetes or elevated glucose level, and a lot of people were not aware about their findings. So the prevalence of hypertension was much higher than I expected. It was 30.2%, and 46.5% were not aware of those findings. So we also calculated the average systolic and diastolic blood pressure, which are found to be 124/77 millimeters of mercury. The prevalence of coronary artery disease was 1.1, which was a little bit higher in males compared to females, and the prevalence of congestive heart failure, stroke, and peripheral arterial disease was less than 1% each. So this brings us to the conclusion. The NCD Nepal study will help better understand the epidemiology in Nepal, and we believe it can help develop guidance in framing national policy in addressing non-communicable diseases. We'd like to acknowledge Health Foundation Nepal, a non-profit US-based organization run by more than 100 US trained physicians. Basically, non-communicable disease project is one of the projects of Health Foundation Nepal. We'd like to thank all the team members of Health Foundation Nepal for this support. Thank you.